Arnold-Chiari Formation. Have you heard about it? Do you know what it is? Maybe you haven't. Let's explain what it is first. A Arnold-Chiari Formation is basically a dysfunction in the back of the brain. So if you look at my crude drawing here, the black is indicative of our skull. This pink in here is our brain. It's attached to the brainstem and it runs down into the spinal cord. Now this area right here, that hole, is the back of or the bottom of our skull. It's called the foramen magnum, and that's where the brain pieces sit, right above there. So under normal circumstances, the brain sits up here, no problem. CSF fluid gets to come around here and go down the spinal cord, comes back up. Everything works great. In an Arnold-Chiari formation, we end up with stuff like this, where the brain, specifically the back of the brain called the cerebellum, starts to either touch the foramen magnum or it starts to herniate down into the canal, and that creates all sorts of problems. For example, we'll end up with symptoms like balance. We could even have things like dizziness, neck pain. We can have headaches. Sometimes people also will start to recognize maybe vomiting or hard time swallowing. It also leads to ringing in the ears. Sometimes we can even get depression from it. So there's a lot that goes on here, and there's actually 4 different types. 0 would mean that the cerebellum is just touching the opening. A type 1 or a type 2 is where it starts to come down or touches and follows into the canal. And then we can get it to where it even herniates even further down here. So there's different degrees of that. But the point is, we can be of help. So what do you do with that? There's extreme cases where they'll do what's called an occipital removal or decompression, where we'll cut this bone out to relieve that pressure. That's one way. What we have found is if we can look at, and the next bone right below this would be the atlas bone. So in our upper cervical work, what we do is we take specialized x-rays so that we can determine the angles to make a correction here to get this to perform to where the water, or rather the CSF fluid, starts to move through here and the pressure equalizes. Get great results with this. This is a lot of fun. This is probably one of the funnest things I work with people. If you don't know or you want some more information, please give us a call here at Upper Cervical or Desoto Upper Cervical, 662-393-4848.